So what is an occlusion? So the upper and lower buccal teeth, dental arcades, are inclined at an angle. You can see that, of approximately 15 degrees. The mandible, so the lower jaw, is 30% narrower of the maxilla, and this is known, I want to show you the word, anisognathism, and this means the chewing surface, this causes the chewing surface of the teeth to actually tilt, so yeah, this is where the chewing takes place, and the incisors come in contact with their occlusal surfaces. So yeah, basically teeth eruption as well. So we talked about temporary teeth. So the first incisor comes in the first week of life, second 4 to 6 weeks, third 6 to 9 months. So that's the big difference, not just weeks, months. And premolars are soon after birth. So first incisors and premolars come around the same time. Oh yeah, so it shows you. So 6 days after birth, no teeth. 6 months, they probably have the third incisor at this point, and 6 weeks is like the second incisor, so it's sort of like Bugs Bunny over here. So teeth eruption. So the permanent teeth, all right, so just to be clear, we're just talking about deciduous teeth here. This isn't just like how the teeth erupt. Now we have the permanent. So the first incisor is like 2 years, the second is 3 years, third is four years, so it's easy, just add a year on. The canine and the third incisors come around the same time. Then you have the wolf teeth, which is like the 5 to 6 month mark, not years. Now the premolars come around the same time as the first incisor. The second premolar. The third premolar comes around the time of the second incisor. So sometimes some come at the same time. P4 comes at the same time as the third incisor. So basically the 3 incisors and the 3 premolars after the wolf teeth, if you don't include P1, come around the same time. And I don't know if that helps. Then you have the first molar, which is about 1 year, molar 2, which is 2 years, then 3 years. It says formula 6. I'm not sure what that means. I suppose it means if you include wolf teeth, maybe. So in terms of the aging process, you also have something called an incisor hook. So basically what this is, so the incisor forms a hook under the lower incisor, and it appears around 7 and 11 years of age on the caudal surface, so the tail end of the corner of the maxillary incisor. So it's usually just I3, so incisor 3, and it's not a really reliable age indicator, but generally it should be 5 to 15 years. And there's also something called Galvain's groove in half of horses. So, okay, if a horse is 10 years old, it comes from the gingival edge downwards. So I assume it's, so this is Galvain's groove. Yeah, so if the horse is 10 years old, maybe this one is, it descends from the gingival edge downwards. If they're 15, it reaches the middle. Okay, so this one's probably 15, sorry. And if it's 20, it goes all the way down. And if they're 25 years, only the lower part, and 30 years, this disappears. So I suppose in 25 years, this part won't be from here to here, it'll be from the middle to the end. And in terms of age determination as well, obviously using teeth isn't very accurate, but yeah, this helps. The first tooth to wear off and fall is actually the first molar, so M1, over 20 years. Let me find it. Okay, so it doesn't actually show the molars, but you just have to trust me. And the occlusal incisor angle, which I mentioned before, is as the horse gets older, it becomes sharper. So it doesn't really show it here, but like if the horse is older, this is sharper, this angle. You have dental nomenclature. So this is known as the triaden dental system. Some people forget the name. So yeah, just to be clear, I'm trying to figure out, I think this is the maxilla and this is the mandible. So the maxilla, yes, because it has 100 and 200. So the right side is always 1. So right is always the first thing you think of. Right, left, then left, right. That's the only way I can remember. I'm really sorry. But yeah, this is the top jaw. This is sorry, my battery was running out. This is the top jaw. This is the lower jaw. And yeah, anyway, getting bogged down in that. So the chewing cycle. So food chewing is cyclical, if they ask, because you have opening and closing of the upper and lower jaws, and it results in a rhythmic contraction of the chewing muscles. The first phase is the opening phase, so they open the mouth. They don't really show it here, but they open the mouth, and the second phase is the closing phase, and the third phase is the chewing force. So just remember the 3 phases. 1 is opening, 2 is closing, 3 is chewing. The dental equipment, so you have a Houseman mouth gag, and it's used for oral examination. We kind of use this in class. It opened the mouth for rasping, and you have a portable light source for oral cavity examination. Obviously, light's important. Veterinary dental equipment, so I only know a few of these. So you have raspers here. Oh, this is also a rasper. These all look like raspers to me. Anyway, so you have handheld dental files or raspers with permanent and replaceable tips with different shape, length, and angle of the grinding surface. I think it totally depends on the teeth you're focusing on. And you have different models of headlamps, obviously. You have a mouth speculum and dental mirror to like see hard to reach places, and an irrigator for washing the mouth out, you know, after you possibly incise the gum as well. You don't want to cause any infection. There are different sized forceps, dental elevators, hammers for wolf tooth extraction, dental probes, dental chisels for teeth cutting, dental pliers and scissors for extracting and cutting cheek teeth. So yeah, you know, you may be shown photos in the exam and asked to identify them. So in terms of oral and dental examination, obviously look at the history, ask what the horse is eating, if they have any weird habits, what the feces looks like, look at their weight, do they have smelly breath? Obviously we do this in small animals too, behavior changes and head shaking because it could be a sign of pain. So yeah, inspect the box and the bed because you'll see the feces there, look at the body, the head shape, like is there swelling, for example, aging, so maybe like the incisor hook I mentioned on incisor 3, external palpation for asymmetry and pain, flushing the oral cavity with chlorhexidine, for example. Look at the incisor inspection because I mentioned the hooks, palpation of the oral commissures, so I assume these are the dips in the teeth maybe. Use a mouth gag to open and inspect the tongue and oral mucosa, like if there's any ulceration, that's a sign that there's let's say sharp cheek teeth, and that's why you have to examine them too. And of course look at the dental records and charts and compare. So dental examination, oh okay, I thought there'd be something useful here. I'll leave it zoomed out. It's important to show 1 or more of the following clinical signs. So if they don't want to maintain a vertical head carriage, or they turn their head when you're trying to make their head vertical, the food is partially chewed and they fill the mouth with hay before eating grain. So yeah, this is a sign of dental pain because hay is softer and it helps them chew the grain. And I think it's purely just to fill their stomachs because grain is hard to chew. Weight loss, subtle lameness, chalism, excessive salivation because of course, you know, there's pain, halitosis, infection in the mouth, mandibular or maxillary swelling, facial draining tracts, cheeks are sensitive on palpation, so maybe because of ulcers, they stick the tongue out of the mouth, maybe again because of ulcers, uni or bilateral discharge, nasal discharge, because of nasal obstruction, they resist bridling, malocclusion, so mouthing or chewing the bit, and head shaking while eating or head tossing, maybe because they're in pain. So as I said, you also have to observe the movements of the head. So yeah, obviously dental examination, you have to use the Houseman gag and the light to look inside. Now obviously restraint is like one of the most important things. You can use regional anesthesia, general anesthesia. So single use ones like detomidine, yeah, I don't know if you remember that, xylazine, romfidine. So romfidine and detomidine are very similar. I think they're both, what do you call it? Oh, I'm going to be kicking myself. I think it's an alpha 2 agonist. Yeah, there it is. Yeah, sorry. I can't believe I just didn't read it. And in combination with butorphanol. And also remember xylazine as well. And yeah, the frequency and of the dental check. So in younger horses under 5 years old, it needs to be done 3 to 4 times a year. Floating, so the rasping or the filing, is done 2 times every year. And the dental diseases, they're at high risk of complication and uneven growth. In adults, so 5 to 20 years, once a year, and basically look for sharp edges, malocclusion, and periodontal diseases. So these are things like, you know, the garginal groove, I don't know, I'm just trying to think of things like, okay, so in companion animals, periodontal diseases are things like gingivitis, periodontitis, old horses over 20 years, more than before, and you do it once every, and you do the rasping once every 2 years. And usually you'll see excessively worn teeth, dental loss, and more periodontal disease. So maybe more gingivitis or something. Race horses, check them at least twice a year and do the filing once a year. I've spoken a lot, so we'll have a break and carry on after.